Everyone. My name is Jessica Weatherstone, and I am a program manager here at KSF. I am also mom to Emma, who is 10 years old and has Kabuki syndrome. And before we head into our break, I'd like to take a few moments to talk about the new community crowdsourcing survey that we're launching today. At KSF, we are deeply committed to driving patient-centered research, which means we are addressing the needs, preferences, and priorities of patients in the Kabuki syndrome community. Understanding this is essential as we prepare for clinical trials, which will help us design treatments and delivery methods that align with your lives. While many of us who've been in the community for years have a really good sense of what our unmet needs are, we need to have solid data that will help guide researchers and clinicians in the right direction. To achieve this, we need to hear directly from you, the Kabuki syndrome community, because your voices, insights, and lived experiences are the foundation for understanding what our community wants and needs. This is why in 2021, we conducted a crowdsourcing survey to gather preliminary data on the symptoms that most affect individuals with Kabuki syndrome. The goal was to identify the research areas that matter most while also understanding the barriers to participating in research. The key findings from this survey revealed that neurological symptoms, primarily learning and intellectual disabilities, low muscle tone, communication difficulties, and sensory processing disorders, have the greatest impact on individuals with Kabuki syndrome. While this isn't surprising to those of us who are active in the community, having this data provides crucial evidence that we can share with researchers and industry partners. It has also enabled KSF to prioritize treatments that specifically target these critical areas. The data we collected in 2021 was incredibly valuable. Now, 3 years later, we're building on that success with the launch of our 2024 survey. This new survey aims to address some of the limitations from the 2021 survey while expanding our understanding of needs and preferences. One challenge with the 2021 survey was that we had a relatively small sample size of just over 100 participants. This limited our ability to conduct meaningful sub-analysis by, for example, by genotype or age. So for the 2024 survey, our goal is to nearly double the sample size with at least 200 respondents. To achieve this, we really need your help. Not only do we need everyone in the room who's eligible to take the survey, we need you to share with your networks because I know all of you have friends in the Kabuki syndrome community who are not watching today. If you see us promoting this survey on social media, engage with those posts. Through likes, shares, or comments, this can significantly boost our visibility and it can help to reach as many people as possible. Another limitation of the 2021 survey was our inability to distinguish between responses from adults with Kabuki syndrome and their caregivers. So for the 2024 survey, we're going to collect responses from both groups of people. If you are the caregiver of an adult with Kabuki syndrome, both you and the person with Kabuki syndrome can and should complete the survey. The approach will allow us to analyze differences in perception of unmet needs between people with Kabuki syndrome and their caregivers. Lastly, the 2021 survey did not have Institutional Review Board approval, or IRB approval. This limited our ability to publish the findings in scientific journals. So for the 2024 survey, we have already obtained IRB exemption, which means the results can be published and shared broadly with researchers and clinicians and our industry partners. In addition, the 2024 survey will expand on our 2021 survey to address three critical areas. Number one, which symptoms have the greatest unmet need? So the survey will ask you to identify symptoms that are currently the most impactful in your daily life. This real-time snapshot is crucial for understanding how symptoms vary by age and stage of life. For example, a cleft palate might be highly impactful in infancy, but after surgery, it's less impactful and may have little impact by adulthood. When filling out the survey, please answer questions based on how symptoms are affecting you or your child currently. This approach ensures we'll focus on symptoms that lack effective treatments. Number two, what routes of administration are acceptable? Several novel therapies in our pipeline involve less common routes of administration, such as dietary changes, IV injections, IT injections, and even microbrain injections. The survey will ask whether these routes are acceptable to you or if alternative delivery methods need to be prioritized. And number three, what potential side effects are tolerable? As Clara mentioned earlier, we are heavily investing in drug screens for repurposed candidates that may help Kabuki syndrome. Many of these drugs have already been taken by thousands or even millions of people, and they come with documented side effects. Some of these side effects are mild but common, while others can be severe but very rare. Understanding the community's risk tolerance will help us prioritize candidates that balance effectiveness with acceptable side effects. With these goals in mind, we partnered with Costello Medical to create the community survey to assess symptom impact and treatment preferences in Kabuki syndrome. The creation of this 15-minute online survey was led by KSF, supported by Costello Medical, and validated by a roundtable of experts, including industry, academic, and patient caregiver representatives. Many people have given their time and input into the survey, and we are so excited to launch the survey with you today. So who can take the survey? Adults 18 and over who are willing and able to provide informed consent can participate in the study. Individuals must have a Kabuki syndrome diagnosis, either clinical or genetic, or be the caregiver of someone with a Kabuki syndrome diagnosis. If you are a caregiver of an adult, both you and the person with Kabuki syndrome can and should fill out the survey. Individuals can be located in any geography, but they need sufficient competence in English in order to understand and complete the questionnaire. So how can you take this survey? The survey can be taken on a computer, phone, or tablet. To access the survey, you can scan this QR code or click on the link, and I'll have Amanda put the link in the chat right now. And then you can also find the link on the left side bar of the event space. We recommend that you take the survey right now during the break. We've expanded our break so that you should have sufficient time to go through it. Our goal is to get as many people to take the survey today as possible. So if you're eligible, we urge you to take it during this time. If you have any questions while you're taking the survey, please put those in the Q&A and we can respond during the break. With that, I'll give you guys a moment to go grab a coffee or snack, stretch your legs, and we can meet back here. I think we're a little bit over. Let's meet back at 40 past the hour. Thank you all, and we'll see you after the break.